Actually, I think it's not something that's generally known that bacteria in the mouth are probably responsible for tooth decay. And certainly if you have that amount of bacteria in your mouth that can precipitate tooth decay, then it can certainly be present enough that with manipulation, such as cleaning or removing a tooth, the bacteria could be put into the bloodstream, and for a transient amount of time, there are circulating bacteria in your blood, which is called bacteremia. Now, under certain conditions, an example would be a person who was born with a bicuspid aortic valve, and bicuspid means 2 leaflets rather than the usual 3. That's an abnormal valve. And as such, the body over time can collect areas of fibrin and platelets that will grab bacteria out of the blood. And lo and behold, you end up with an infection in a valve in your heart when you started out maybe having a tooth cleaning. And I really have to praise my dental colleagues, the endodontists and the oral surgeons and those who practice general dentistry for their capability in this time frame in our culture. The other side of it is that I think a vast majority of people would not link oral dental health to any form of heart disease. And while what I'm about to say may not be particularly germane to the point of your discussion here, which is to inform people and encourage people to see about their dental health. Keep your visits, make sure, and do your flossing. Make sure you brush your teeth, as often as you can throughout the day. There is some mounting evidence that a generalized low-grade infection, if you will, at least accumulation of bacteria in the mouth, may produce a low-grade inflammation, not necessarily infection, but inflammation, which is the accumulation of inflammatory cells throughout the body, and that inflammation may be translated to artery disease. And the arteries in the heart, the arteries in the neck, the arteries in the legs, the arteries in the abdomen, there may be some correlation, and I think that is a fertile area of research as to what's the mechanism of that. Is it true, number one? Is it true? There's certainly a suggestion of it. And I'll give you an example. In the northeastern part of this country, there is a cooperative study group called the Northern New England Cardiovascular Cooperative Study Group. And I had the opportunity some years ago to visit with one of their investigators. And this group is a compendium of hospitals, cardiologists, and heart surgeons. And one of the aspects that they have found is that people who have a chronically elevated white blood cell count, those people have a higher mortality than people who have a lower white count, which indicates that there is some relationship between inflammation and an elevated white count and then coronary artery disease. Now, the exact mechanism is unknown, but certainly those of us who operate on these blood vessels would tell you unequivocally that arteriosclerosis of the arteries of the body has an inflammatory component and is an inflammatory disease.